All right, so hi everyone, I'm Pascale. I'm a data scientist at Holmusk, and I'll actually be joined for the Q&A with two of my colleagues, Jawei and Srinash. So what we've actually tried to do at Holmusk is look at how we can actually derive information from imaging on, most particularly on Alzheimer's disease brain imaging, and then map it to a cognitive state. So some of you may be familiar with the Alzheimer's disease. So here in Singapore, as well as worldwide, there's actually approximately 35 million cases of AD. Within the next few years, it's estimated that it will come up to almost 106 million. So currently, the cost and burden of dementia is very large. It goes into billions, and it's thinking that within the next couple of years, it'll go to trillions. Now, why is it so important to look at Alzheimer's disease? Well, it causes major atrophy throughout the brain. Compared to other diseases, Alzheimer's disease has no drugs that have been approved since 2003. So it remains an incurable disease. So AI is one of the strategies that have been used to look at how we can actually find more cures and how can we actually help the population that will have Alzheimer's disease. So the current models, what they use is one or multiple inputs, such as MRI, genetics, CSF, and cognitive scores. And then they use deep learning neural networks, and then they predict, the diagnosis or the risk of onset. Now, the limitations of such models is that, they are great diagnostics tools. Right now, they achieve, more than 90% accuracy. But the problem is that a lot of the time they use 2D imaging. 2D images actually ignores the spatial relationships of brain regions, which actually diminishes how much insights you can really get. And they also only look at MRI and not PET scans, which are more limited in numbers, but they are more rich in biomarkers. So what are we trying to do at Holmusk? We're trying to identify the relationship between cognition and brain biomarkers. So when you're suspected of having mild cognitive impairment, what you do is that you go to your doctors and they give you this test called ADAS-Cog. It's composed of 13 questions. What we wanted to know is which of those questions are actually the most predictive of Alzheimer's disease. So we selected 4 of them. Most of them are actually in memory and learning, so they're called recall. And other of them are more into problem solving and word recognition. So we use simple models such as random forest and XGBoost to look at the important ones. Now what that does is that now we're trying to say, well, what in the brain could actually predict this cognitive score? So what we have is actually a model that incorporates 3D images. We can use 3D images multimodally. So what that means is that instead of using a 3D input, we use a 4D. And if you guys know the RGB aspects, is that you can actually, instead of having R, G, and B, you actually have channels for an MRI, a channel for a PET, and another channel for another PET. And the composite of that will actually predict the score. So we used a CNN with Inception units and a ResNet skip connections. And then we can do 2 things. One of them is that we can actually have fully connected layers and predict the ADAS-Cog score. In this case, we actually have 4 different regressions that come out of it. The other aspect that we can do is that we can look further into the brain and say, hey, which regions of the brain were actually important for question 1, question 4, question 7, and question 8. And from this, we're able to actually generate a mask that can extract biomarkers. The other aspect that we can do is that we can just use the fully connected layers to make a classifier and then identify whether our model is the same as other models as well in terms of diagnostic tools. So these are our model predictions and what we got. So what we saw is that the imaging that we were able to give them were quite good in memory and learning. So we were able to achieve an R-square of 0.8. But it was less good in aspects such as problem solving. So the issues here is that word recall and delayed word recall have memory and learning components, but really which brain region is really for problem solving? It's most likely a large area and very, very complicated aspects. Well, what does this mean? I mean, you're putting some images and you're trying to say this is the score. So as I said, when you do the testing, what happens is that your doctor will give you 10 words. So these are kind of 10 examples of words. And they'll ask you to remember it, and after 3 minutes, they'll say, how many can you remember? So of all the people that we have here, you know, how many do you actually think you could remember as a healthy young adult? So what can our model do? What our model does is that we give it brain glucose consumption, simply, and this is an FDG PET. We put it in a CNN model, and then it can predict the words that you can remember, plus or minus 1 word. So I could say from this brain scan from this one person is actually 9 words, or maybe 8 or 10. But this other person here would probably remember 5, plus or minus, 4 to 6, which is actually quite exceptional considering it's just a brain scan. So the other aspect that I talked about is the GradCam, which is a really nice thing when you're talking about cats and dogs. So if you're trying to identify this is a tiger cat, then you can have, oh, this is a cat, and this is the region that the model was looking at to actually predict a tiger cat. But for brains, how does that work? So this is usually the images that my team works with. So we have a cognitively normal brain, and it's a SPET scan. And then we have an Alzheimer's disease brain. After a lot of processing and image registration, this is what it looks like. Now with the model, what it does is that by using or leveraging GradCam, the model was able to say, okay, for Q1, these are the regions in a 3-dimensional mask that are important. But for Alzheimer's disease brain, it's looking at something that is completely different. So we're able to say, we're going to extract information from those 2 brain regions. So as I said, at Holmusk, we're really trying to figure out how can we actually leverage data and look more deeper inside it, not just build a model to actually predict something and get a 0.99 score. What we really want to do is that what can we actually deliver for pharmaceutical and healthcare practitioners to be able to do better diagnosis, better treatment, or drug discovery. So what I just explained is actually our phase 1, which is AI for imaging. And the data that we'll actually get from these imaging will be incorporated in a bigger model called a quantitative systems pharmacology. Now that's based mostly on ordinary differential equation, but it's a dynamic model that uses both neural networks and AI. And then we can predict it. So clinicians or physicians can actually look into virtual clinical trials and be able to target specific molecular pathways. So this is why we're actually working in a group to really leverage into biology as well as data science and every single tool that we can. So this is my team, and these